And now, a moment of education from SURGUCATION.
The main benefit of the ear tube is to release the pressure from the middle part of the ear to the outside environment. In a way, it takes away the need for our own ear tube, which is called the eustachian tube. The best benefit of ear tubes is to improve hearing in children that are affected by fluid or recurrent infections. Other benefits is that it decreases the risk of having ear infections. It also makes it easier to treat ear infections because we typically recommend an antibiotic drop rather than needing to give an antibiotic by mouth. Also, the ear tube, when in place, helps that when a child does have ear infections, that the ear infections tend to be less painful, less risk to the hearing, and shorter living. The risks of ear tubes mostly include the risk of anesthesia, where the child does need to go to sleep to have the ear tubes placed in. And then there's the risk of the ear tube being in place, or the risk of what happens when the ear tube falls out. In general, an ear tube, when it is in place, it stays in place for 8 months to a year. It can last a little bit longer depending on the type of tube that your doctor uses. When the ear tube is in place, sometimes the eardrum can have a reaction to that ear tube. The reactions can include that there can be drainage of fluid from the ears, there can be some tissue called granulation tissue, which can cause bleeding, and sometimes the ear tubes can also block because of mucus in the ear, and then the tube essentially isn't working any longer. When the tube does fall out, we expect the eardrum to heal behind it. However, in some cases, when the ear tube falls out, there can be some scar tissue of the eardrum, or there can be a hole left behind. Also, sometimes the tubes don't fall out on their own, and it requires your doctor to remove them either in clinic or under anesthesia for another procedure. Also, sometimes the tubes fall out too early, and if this occurs, your child may need another set of ear tubes.